Principal Investigator, Mary Mark. Implementation of standard order sets for pressure ulcer prevention based on Braden Risk Assessment subscales. Pressure ulcers place a major burden on the healthcare system today. To assist in preventing the occurrence of pressure ulcers in pediatric and adult inpatients, a risk assessment must be performed to identify who's more likely to develop them. This study will look at using an implementation science approach at the Glenrose Rehabilitation Hospital to implement standing orders based on the Braden Pressure Ulcer Risk Assessment tool. The successful implementation of standard orders based on the Braden subscales will impact all Glenrose Rehabilitation Hospital pediatric and adult inpatients for whom there is an associated risk of developing pressure ulcers, therefore decreasing their incidence. Principal Investigators, Dr. Rebecca Charbonneau and Michelle Wallace. A retrospective study examining pressure ulcer risk factors in rehabilitation patients with spinal cord injury. The development of pressure ulcers is a significant health complication of spinal cord injury patients. The focus of this study is to identify risk factors for the development of pressure ulcers during the rehabilitation process for patients with spinal cord injury. Retrospective data will be examined to determine relationships between pressure ulcer development and the level of spinal cord injury and completeness using the ASIA scale. Findings from this study may guide individual care plans or interventions by early identification on admission of those at high risk of pressure ulcer development. Any gains made to decrease the prevalence of pressure ulcers in the rehabilitation setting will have a positive impact on patient outcomes and quality of life. Principal Investigator, Dr. Vivian Mouchawar. Prevention of secondary complications of stroke and traumatic brain injury using intermittent electrical stimulation. Deep vein thrombosis, DVT, or blood clot usually occurs in the deep vein of the leg. It's a leading cause of disability and mortality in the world, with costs of care estimated in the billions of dollars. As a common complication of patients who have suffered from a stroke or a traumatic brain injury, it's associated with reduced mobility and even paralysis. This study will look at testing an exciting and innovative method developed by a University of Alberta lab, which uses transcutaneous electrical muscle stimulation to activate the muscles of the lower leg to promote blood flow, thus reducing the formation of clots and preventing pooling of blood in the veins. In addition to the prevention of DVTs, electrical muscle stimulation may have other beneficial effects not possible with currently used interventions, such as preserving muscle strength and reducing spasticity and contracture. Principal Investigator, Dr. Sukhdeep Dulai. The utility of flexible carbon fiber ankle foot orthotics in idiopathic toe walkers. Idiopathic toe walking is a condition where a child continues to walk on their tiptoes beyond 3 years of age. It's a common condition among children, and early management is necessary to prevent secondary issues such as heel cord contractures, decreased ankle stability, and pain. The usual and recommended treatment for the condition is an articulated ankle foot orthosis, AFO, which can stimulate a normal heel strike and ankle rockers. Unfortunately, their effectiveness in this patient population is unknown. The aim of this study is to examine the effectiveness of a new flexible carbon fiber ankle foot orthosis in achieving a normal heel strike and ankle rockers. If this brace is found to be effective, the results will be used to develop a longer-term effectiveness trial that would directly influence the clinical management of these patients, reduce the burden placed on the healthcare system by providing a long-term solution, and would be more socially acceptable to patients while wearing them. Principal Investigator, Dr. Bin Zhang. Using a virtual training environment to examine cognition and visual perception in patients who have had a stroke. Approximately 50,000 Canadians suffer from a cerebrovascular accident each year. 80% of them are caused by a blood clot buildup within the blood vessels, and 20% are caused by uncontrolled bleeding in the brain. Stroke-induced damage to the brain can severely compromise a person's ability to walk, move their arms, speak, see, and make decisions. For those who survive a stroke, effective rehabilitation strategies are needed to allow them to perform activities of daily living again. This study will assess cognitive and perceptual problems in patients who had a stroke by combining eye-tracking technology with the use of a virtual reality training environment, i.e. the Karen system at the Glenrose Rehabilitation Hospital. The knowledge gained from this study will help clinicians understand why some stroke patients have difficulty returning to their community following rehabilitation, and will also assist in the development of an effective training protocol to enhance rehabilitation performance and patient outcomes. Principal investigators Dr. Leslie Weart and Dr. Dax Rumsey. Evaluation of the 6-minute walk test, or 6MWT, in children with juvenile idiopathic arthritis, normative values, and reproducibility. Juvenile idiopathic arthritis, or JIA, is one of the most common chronic diseases of childhood, characterized by swelling of the joint, tenderness, restricted range of movement, and limitation of movement secondary to joint pain. It's an autoimmune condition defined by at least 6 weeks of arthritis starting before the age of 16 years without a known cause. One of the most common indicators of this disease in children is a change in functional ability, including walking. This study will evaluate the use of the 6-minute walk test to establish normative values and psychometric evaluations for this patient population in order to increase its clinical utility. The ultimate goal of this study is to include the 6MWT as part of a comprehensive monitoring strategy to ultimately enable optimal preventive care of patients with juvenile idiopathic arthritis. Principal Investigator Dr. Ming Chan. Towards clinical implementation of a novel portable force platform. Muscle weakness can develop in many patients with a wide range of conditions. When severe enough, it can have a profound impact on a patient's ability to be independent and function safely in the community. To assist in the diagnosis and treatment of this weakness, precise measurement of muscle strength is important. Current clinical practice is based on subjective grading that is highly unreliable and has significant restrictions. This study will look at using a portable force platform designed at the University of Alberta that is built on a custom-built modular wheelchair base. The study will recruit healthy adults in different age ranges to assist in the clinical evaluation before being deployed clinically. As muscle weakness is one of the most important barriers in functional independence and personal safety, if proven successful, this device can potentially be deployed in a wide variety of clinical settings.